Hello. Today we're going to be taking a look at the portrayal of psychotic disorder in the movie Canvas. The case presentation was compiled and created by Haley, Natalie, and Nathan, while the personality analysis was written by Andrew. The character of interest, our proband, Mary Marino, is the center of the film, and the story illustrates the struggle between her mental state and her family relationship. She is the mother of Chris and married to John Marino. Mary is seen very involved with family life most of the time. She shows excitement and love towards her family. She also shows precise motor capabilities, such as sewing and art, throughout scenes. Her struggle with some form of psychotic disorder becomes evident from her frequent psychotic episodes, where she seems to lose touch with reality.
We diagnosed Mary with schizophrenia with catatonia. This disorder is categorized as a psychotic disorder in the 5th edition of the Diagnostic Statistical Manual of Mental Disorders. Schizophrenia in general is characterized by social and cognitive impairment, atypical behavioral patterns, often hyperexcitability, repetitive behaviors, or stupor. Individuals with schizophrenia often seem to have trouble differentiating reality from fantasy and have disorganized thought. Schizophrenia is sometimes comorbid with catatonia, which is the abnormal movement as a result of disturbed mental state. Schizophrenia has a typical phenotypic expression onset in late adolescence and slightly later in females, according to a study on the epidemiology of schizophrenia in 1994. There is also an early onset manifestation of schizophrenia in which phenotypic expression occurs in adolescent stages. Schizophrenia affects tons of people worldwide, around 1% according to a study on the demographics and epidemiology of schizophrenia. We diagnosed Mary with schizophrenia with catatonia because her observed behavior fit that of the required diagnostic criteria in the DSM. The first example of this is Mary seen wandering into the rain in the middle of the night with no obvious purpose, repeating her speech in an incoherent way. She is heard saying she doesn't want to go back to an institution over and over and that she insists on moving to the other Florida, when there is in fact no other Florida. This fits the first and the third criteria of the primary criterion section. To be diagnosed, at least 2 of the shown characteristics must be present. The second piece of evidence was Mary's numerous references to the voices in her head, especially once she is institutionalized. She's perceiving voices in her head despite the voices not being real or present. Additionally, there's no illustrated use of substances that Mary uses throughout the movie that could be an etiological factor in her psychotic episodes. However, she's later given medicine as a treatment, but that's different. We also see her relationship deteriorate with her son and husband, another criteria for schizophrenia. She isn't able to connect with her son as well toward the end of the movie. Finally, an important aspect to Mary's psychotic breaks are her hyperexcitability and excessive motor function that seems to be out of her control. As for example, when she grabs a knife and accidentally cuts her son during one of her episodes. The DSM indicates that the diagnosis for schizophrenia should indicate whether catatonia is present, and in the case of Mary, it is. Mary does not seem to show negative symptoms or loss of emotional expression or motor capabilities. She remains excited to see her family and her son, especially throughout the entire film, and continues to paint after she's been institutionalized. Despite Mary not showing loss of abilities over time, the diagnosis for schizophrenia is still valid.
The treatment for schizophrenia with catatonia has 2 major steps. First, the patient will need to be put on the antipsychotics such as these. Second, the patient will need to participate in cognitive and behavioral therapy to help retain normal brain function. Once these antipsychotics reduce some of the positive or gain symptoms of schizophrenia, most research suggests that the combination of both medication and psychotherapy is the most effective treatment approach. In Canvas, schizophrenia is shown as an accurate level being portrayed by many episodes that Mary has, from the delusions of people watching her to the voices in her head. Because the film director had a first-hand experience with schizophrenia, the disorder is shown as real as it is. In many movies, such as Nightbreed, the disorder itself is caused by drugs and alcohol, causing the character to become violent. This has created a negative mindset for viewers on effects of schizophrenia. These are the citations. Thanks.